Welcome to the media briefing today. The doctors we have today are Dr. Zhang Shukwan, Head of Communicable Disease Branch, CHP, and Dr. Lau Ka-hin, Chief Manager of the Hospital Authority. Dr. Zhang, please tell us about the latest situation. Good afternoon. Last night we had 8,628 cases tested positive on PCR test and 13,022 cases tested positive on RAT. They were all reported yesterday. Today's total positive number is 21,650 cases, plus the cases before. The accumulated number of infections in the fifth wave is 984,231 cases, with 658,000 cases tested positive on PCR test and 326,149 cases tested positive on RAT. Among the 8,628 cases, that is, cases tested positive on PCR, there were 1,354 cases found to be positive by the HA screening. 1,487 cases were returned from our public services laboratory, and 5,787 cases were reported by private laboratories. Among the 1,487 cases returned by the CHP, no strain L452R strain has been found. 224 cases tested negative of the strain, and 1,200 plus cases results are pending or viral load is too low. We have 9 imported cases from various origins, 2 from Mexico, 2 from Thailand, 2 from Singapore, 1 from the Middle East, 1 from Germany, 1 from Indonesia, and one from Indonesia. 2 cases were caught on arrival at the airports. The other were tested positive in quarantine hotels. Concerning fatalities, the HA has reported an additional 289 fatal cases, including 202 cases who passed away yesterday, plus subsequently deceased patients. From the HA altogether, there are 4,908 disease cases in this wave, plus 15 cases who passed away outside the HA. So the total number of deaths in the fifth wave is 4,933 cases. Among them, 1,950 cases were female, and some 2,900 cases were male, aged between 11 months old and 112 years old. 58% were residents in care homes. Some 11% of them received 2 jabs or more. 87% of the deceased patients had chronic illnesses. Now the accumulative death rate is 0.5%. For people aged 80 or above, they accounted for 70% of the death. The death rate for them is 8.4%. Now the analysis is similar with what we reported yesterday. For care homes, we have 4 more care homes with outbreaks since yesterday, including 4 residential care homes for the elderly people. And we have no new outbreaks in our CHDs. 98 elderly residents and 14 staff members were infected. In the past 2 weeks, 368 care homes, including 106 care homes for people with disability and 262 care homes for elderly people were affected. Altogether, 10,728 residents and 2,673 staff members were infected. That's all for my report today. Now, Dr. Lau, please tell us about the situation in the HA. Good afternoon. We have 10,522 patients receiving treatment in our public hospitals, the North Lantau Hospital, Hong Kong Infection Control Center, the CHP's Infection Control Center, and the AWE Community Treatment Facility. Last night, we reported 58 critical patients, 115 serious patients, and 119 critical patients are receiving treatment in ICUs. As at 0 a.m. today, in the past 24 hours, 202 COVID-19 patients tested positive passed away, including 120 males and 82 females, aged between 20 and 104. Now, the following is the details or analysis of the deceased patients. 112 deceased patients came from care homes. And among the 202 deceased patients, 129 patients were not vaccinated. For the remaining 48 patients had 1 dose, 24 patients had 2 doses, and 1 patient had 3 doses. For people aged about 65, there were 185 deceased patients. Now, for 7 cases who were relatively young. First, as the 20-year-old patient. At birth, the patient was born with a heart disease. The patient required constant follow-up consultation with a constantly low blood oxygen level. That is a chronically ill patient. Now, a 24-year-old deceased patient had muscle atrophy as well as a heart disease, fat liver. The patient resided in a care home for people with disability and required long-term care with chronic illness. The third disease was a 46-year-old patient. The patient had hypertension and diabetes as well as a late-stage kidney failure condition. The patient's admission was not related to COVID. The patient had an stomach inflammation and required dialysis. That's a common reason for admission, and then the patient was found to have COVID. The fourth patient, a 49-year-old patient, there was no particular illness with the patient. When the patient approached the ANED, the patient already experienced breathing failure. The X-ray shows opacity on both lungs. The patient was admitted on the 14th and passed away on the 16th at ICU. We have referred the case to the coroner for examination. And then a 57-year-old patient with epilepsy. The patient has seizures, residing in a care home with a low count of blood pellets, and the patient was a hepatitis B carrier.
The sixth patient is a 57-year-old patient. Although this person is 57 years old, he has high blood pressure, epilepsy, and has had a stroke. And the blood vessels are clogged. This person lived in a care home and was not able to move around. A 59-year-old also had a stroke. And also had TB and needed to take medicine, so also a chronic patient. Well, we have a backlog of figures. So from March 5th to March 15th, altogether 87 patients passed away in public hospitals, including 45 men and 42 women, aged between 40 years old to 104 years old. The 40-year-old patient did not die from COVID. This person fell from height and died, but then was confirmed positive after being admitted into hospital. So in the past day, 1,112 patients have been discharged from hospital. 35 patients were confirmed when being vetted and screened into hospital, and 40 other patients are considered close contacts. Amongst the staff, as of today, 18,506 staff members have been confirmed with COVID, out of which 10,152 staff members have recovered and gone back to work. And on the booking via cell phone system, currently, infected patients can either call in or to use the care booking line system to make an appointment in 23 designated clinics starting from March 18th, which is tomorrow, starting at 7 a.m. Other than reservations made by phone number, can also use HA Go app, and there would be a feature called booking for designated clinic, and they will be able to make booking for an appointment at one of the designated clinics. Through this feature, you'll be able to see the bookings quota status and be able to make bookings and also make inquiries on booking and cancel appointments. Members of the public will need to download the HA Go app system and then register to become a user before using the system for booking. At this moment, in the initial stage, this can only be used by those who have made registration at public hospitals or who have used public hospital services before. In the second phase, we will also cover those who have not yet been registered via public hospital, so that they will also be able to make an appointment via this app. For those who have not yet registered with public hospitals or used our public hospital services, they can still adopt the current method to make a booking by phone. Remember to dial in at during opening hours. So that is all for today. We now come to Q&A. Please identify your media organization before you ask your questions. The lady in the middle, please. Hello from TVB. I have a few questions. First of all, on Mr. Xiaobo Long, who held a meeting in Shenzhen yesterday, said that we must also use Chinese medicine. So how can we realize the potential of Chinese medicine? Other than giving out the Lianhua Qingwen Jiaonang, how can you also optimize Chinese medicine usage? Are you using that already? How do you work with the Western practitioners to also adopt the use of Chinese medicine? And when will you apply the use of Chinese medicine? Have you used it before? Secondly, how do you deploy the halls? So which hall is manned by the HA and which are under by SWD? We have seen deaths at the AWE, and the HA said that that patient died in the hall manned by SWD. I want to know how many doctors and nurses work at AWE right now. Have you looked at the previous medical records? Are there any doctors and nurses who are working under SWD? How many of them are there, and are they stationed there permanently? And how long would they, or how often would they visit the AWE patients? And what are the differences between the patients who stay in the different halls manned by SWD and HA. I think I said yesterday or the day before that we're going to work with the government to distribute proprietary Chinese medicine, including 莲花清瘟胶囊、金花清肝颗粒 and 活香正气片. We also provide Chinese medicine services in other places, including some that have been provided at the AWE. Discharged patients will also be offered Chinese medicine services, and recently we have also done that in elderly homes. We also have our own Chinese medicine department under the HA, which works together with other organizations to provide the best care for our patients. There are 5 halls managed by the HA at AWE. So it's hall 1, 2, 8, 9, and 10. So halls 8 to 11 can take in 1,000 patients. Previously, we only took in those with mild symptoms and those who are fairly young and can take care of themselves. But in the 5th wave, we decided to take in patients with more severe symptoms, those who are elderly and who could not take care of themselves. It may seem that the number has decreased because the elderly patients need more care and treatment. Therefore, we wanted to focus all our resources on those patients. So in halls 8 to 11, we now have a support team from the mainland assisting us in taking care of the patients. We are also going to open up more hospital beds in the community and in other public hospitals. Once again, we'd like to express our heartfelt gratitude to the central government for sending in support to help us take care of our patients. There are a few other halls at the AWE operated by the SWD. However, I do not have details right now. I believe there are around 5 halls, but I do not know how many patients there are. All I know is that there are doctors working in those halls, and I know there are doctor visits every day. They also have frequent visits from outreach doctors and patients to provide medical advice and to provide medical treatment when needed. So it's much like our outreach team visiting RCHEs to treat those who are in need. The outreach team mainly is a support for the elderly so that they do not need to commute to the hospitals. And this time we're also able to use the outreach team to help support those staying in the AWE.
Next question. The gentleman over there. 200 patients are staying in these halls. We will continue to increase the number of beds with more manpower and better support. For stable patients who still require medical treatments, including those requiring oxygen support, intravenous injection or antiviral drugs, these patients will be transferred. When we are able to transfer these patients to the AWE, and when A and ED patients are transferred to AWE, then we will have more capacity in the public hospitals. There are better equipment as well as ICUs in public hospitals. We will make sure that appropriate patients are treated at appropriate places. Sorry, the speaker is not coming through. The speaker is not speaking through the mic. As far as I know, the hospital authority has sent a doctor to see the situation. You ask whether the patient was eating normally before death. Well, there are hundreds of patients, so doctors will not be able to see each patient every day. So when the caring team finds out the patient is not eating well, and it seems that the patient is not breathing properly, and there is the sound of phlegm, then body check will be performed, and medication will be prescribed, or even arrangements will be made to perform X-ray scans for patients in hospitals. So the HA is providing medical care in these halls, and social welfare department has another team taking care of the patients. The gentleman at the back. Good afternoon, doctors. I'm from Orange News, Leung Hei Keen. Now, the mainland medic teams have been deployed to the front line today. So what is the situation now? And also, elderly people staying in the AWE, previously, because of the lack of manpower, no care was offered to them for many days. No one helped, no one cleaned them. You said the situation was not satisfactory. Now, with mainland medic teams deployed to AWE, is the situation improved? Now, about some details of the cases. The 49-year-old deceased patient. Dr. Lau said no chronic illnesses were discovered. So what about vaccination record? Which strain did the patient catch? And according to the media in Israel, there are patients carrying BA.1 and BA.2 variants. Do we have similar patients in Hong Kong? If we have, will it pose a greater risk and burden on our fight? Now about the mainland medic support team. A few days ago, they have already been deployed to AWE. Yesterday, more experts arrived. So the previous few days were for them to familiarize with the environments and our procedures, and points to note, and how we can communicate. Starting today or tomorrow, the mainland medical experts are beginning to work. It will definitely bolster our capacity to care for patients. I don't have the exact number in terms of patients. Well, from a common sense perspective, with the additional 300 to 400 medical workers from the mainland, it will definitely alleviate our shortage of manpower. through the opinions from experts and with the additional hands, we want to provide better service for the public. If a patient is bedridden in AWE, then at present it is not very easy to provide cleaning services for the patient. The idea of the AWE is to provide service to patients with mild symptoms who are mobile. So there are some constraints. However, we will not tolerate substandard service simply because of the constraints. We will turn the patients on bed regularly, because for elderly patients they cannot turn on their own, so it may cause problems or sepsis. That's what we have been doing even before the Mainland medical team arrived. With the Mainland medic team, we can offer more services. We have a lot of capable doctors and nurses within the teams, and it will definitely improve our caring service. Now, about the diseased patient you mentioned, the patients did not seek medical assistance with us, so we have little record of the patient, and the patient was only admitted during between the 14th to 16th. That's why we have to refer the case to the coroner to see if there are other undiscovered illnesses. Maybe the patient sought medical assistance outside the HA. Well, the information may not be available on the computer system, but maybe it is on the handwritten medical record. The deceased patient has received 2 doses of vaccination. The last vaccination date was August last year.
變種病毒有冇補充，張醫生？變種病
Any supplement on the Omicron variant strain? Well, at this moment, we have not heard from such a situation in our cases. Well, it might be uncommon, but we would of course observe the happenings. Next question, please. From Now TV, first of all, I'd like to follow up on the HA Go booking app. So would it be much more convenient to use the app instead of calling in by phone? How many slots would you open up each day? I also like to ask about the deaths at AWE. So there has been reports saying that an ambulance arrived like 30 minutes late, so there was actually a delay in sending the patient to hospital. Would the HA also consider installing some equipment such as ventilators to help the patients? And we've also heard rumors online that some people are selling off their anti-epidemic bags. Would there actually be consequences for reselling the anti-epidemic bags? You might need to call a few times to be able to get through to make a booking at the designated clinics. We have taken note of the situation. We already have an existing HA Go platform. If you haven't been using it, please download it, because it's very useful. you could check when your next checkup appointment is, what kind of medications you're taking, and what documents you need to bring in for your next visit. So we have added in a new feature to be able to make a booking at the designated clinics. We want those who are a bit younger and who cannot make use of the care booking line to make good use of HA Go, because they'll be able to see very clearly the quota, and to allow the care booking line for the elderly. The quota for the elderly have not been used up 100% in the past few days, which means that those with top priority can still make a booking fairly easily. I am not too clear on that. I believe everyone wants to make a booking within 2 to 3 days. I mean, it's not significant at all if you are able to make a booking 10 days later. We want to give a booking date for those in need as soon as possible. It's just like buying a movie ticket. I'm sure most people know how to purchase movie tickets online. We just want to convenient young people, because on the app you'll be able to see very clearly which clinic still has a quota. And so it's a very convenient system. And you must have downloaded HA Go to be able to use it. So please remember to download it and register as soon as possible. On the point on ambulances, I cannot speak on behalf of the Fire Services Department, but the director of FSD has appealed to the public to only call ambulances for emergencies, because ambulances are for those with urgent need. If you call the ambulances when it's not an emergency, you're actually taking up the time and service of those who are really in need. So I agree that we do have some emergency equipment for use at the AWE. Even without the mainland team, we still have doctors, and if there is a need, we do have the adequate equipment to do that. The anti-epidemic bags are distributed by the government to those who are under home quarantine or isolation. I hope that no one will be trying to make a profit out of it. The lady in the second row. I'm from ... News. How many private doctors are helping out at the AWE? Are there any negative pressure beds? And if there is need for emergency, do you have to send the patients off to the nearest hospitals? Are you able to cater to emergency demand? So that there are 2 antiviral drugs for use in Hong Kong now. Can you tell us the application of these 2 new oral drugs? Do patients recover very fast after taking in the drugs? Do people get side effects out of taking the antiviral oral medication? And how many people are actually isolating at home? Do they also receive food and medical supplies? I don't have a figure on how many private doctors work at the HA. I just have a general number. As of March 15th, about 170 voluntary doctors and 390 nurses have joined in the anti-epidemic work for the fifth wave. Ever since we made an appeal for doctors and nurses to join us, we have seen an increase in number. Of course, the more the better, and we especially need more help for the night shift. We hope that those who have left the HA or who have retired would come back and help us. We do have a WhatsApp number. If you're interested in working voluntarily for us, our WhatsApp number is 97888960. Please send in a WhatsApp with your intention of interest, and then you can communicate with our staff. On the antiviral drug, both drugs have been in use since yesterday. As of March 16th, we have for molnupiravir, we have already given it to about 2,000 or 6,200 patients. As for Paxlovid, manufactured by Pfizer, since we only started using it yesterday, only 183 patients have taken it so far. We give them to patients who are admitted to hospital, and we also give them out in the designated clinics, elderly care homes, emergency rooms, and even in some of our isolation facilities. If the doctor finds it suitable, then it will be distributed to the patients. I do not have a number on hand on the number of those still quarantining at home. But in the past 2 weeks, many have not been admitted to hospital or to isolation facilities, and therefore many are isolating at home. The OGCIO and other government departments are expediting process in distributing out anti-epidemic bags. The HA also provides information to support them. Perhaps Dr. Lau can say something about home or stay home safe scheme. Well, for those of you who have tested positive at home and are waiting to be admitted to isolation facilities, you can call a hotline. If you run into any problems, you can call in to make inquiries. Let me take a look at the number.
Let me tell you the number later when I found it. They can call the hotline. The inquiries usually are symptoms and also the time of waiting. And also there is the patient support call. So the Department of Health would tell us, would inform us the high-risk positive patients, including elderly people and young people and people with particular illnesses. We would call them, ask them about the situation and offer them with advice. And also to learn the needs as soon as possible. The third kind is a teleconsultation service provided by doctors. Sometimes we find that teleconsultation may be able to help a caller. So we will arrange a doctor to offer advice and recommendations to the patient. And also the designated clinic. For positive patients with mild symptoms, if they want to see a doctor and get drugs, they can make a booking with as the 23 designated clinics, and they can also make use of the HA Go starting tomorrow and go to these clinics via designated taxis. So if you are feeling very unwell, or if you experience warning signs, for example, hard breathing, sustained fever despite having antipyretics for 2 days, and so on, then you should seek medical help immediately. So I've mentioned a system 2 days ago. That's a link. If you are tested positive at home or community isolation or quarantine center, you will receive an SMS with a link. Via the link, you can enter your information, including age, high-risk factors, and symptoms. If you have entered symptoms, then the system would tell you what you should do. For example, you should go to the designated clinics, you should call a hotline for inquiry, or if you should go to A&ED directly. After registration, the system would remind you of a RAT test. Upon a negative result, you can leave isolation and so on. In short, after testing positive, you would receive a SMS, and there would be a link, and you can register. All these are for providing support to patients isolating at home or waiting to be sent into isolation. The idea is to offer them with immediate help. I believe that you would have access to all kinds of information at home. So I hope that with the additional information as well as our help, you can complete the isolation safely. Next question, the lady in black. Good afternoon, Ming Pao Daily. Dr. Zhuang, about yesterday's specimen collection at community testing centers, what was the positive rate? Do we have fewer people going to get a test? Professor Yun said that towards the end of the fifth wave, we will still have thousands of cases per day for as many as several months. So what about your take? Now, what about the total number of critical and serious patients, not the additional ones? Now, for patients in hospitals, what is the number of serious patients, and what is the ICU's occupancy rate? Now, for oral medication, according to the guideline, will patients not receive such medication if they have received the free jabs? Is it because of the lack of medication? What about the chronic patients or elderly patients? Even if they have free jabs, would it still be risky if drugs are not prescribed to them? And how many death cases have received free jabs? Now, for Dr. Lau, you said for some halls in the AWE, there are HA staff manning the halls. So how many halls and how many medical workers, what do they do usually? And if a hall is run by outsourced contractors, how many rounds will the outsourced contractors make each day? And what about the checking of vital signs? Is it because of lack of monitoring? That's why elderly people died and were not discovered. I don't have the figure yesterday. Every day we are doing some 100,000 tests. For today, among the figure today, 5,787 were returned from private laboratories, paid or not paid. So the positive rate is around 6%. So that's the overall figure. And also we have tests performed by the HA and also our lab. It is difficult to judge the trend at this point. In the past week, the daily case number was 30,000. Today, it seems that the number is lower, but we still have to wait and see. Many people have fallen ill, and we have a lot of transmission chains in the community. Also, many patients are asymptomatic, and we cannot detect them. So the number will not climb down very swiftly. So sometimes the experts would say that the situation may persist for a long time. It is possible. Well, I will try to answer your questions because you have asked so many questions. For ICU, the occupancy rate of negative pressure beds is 87%. 119 patients are undergoing treatment in ICU. They are in a critical condition. We reported some new cases yesterday, including the 58 critical patients I mentioned just now. Some of them are in ICU. Some of them are cases reported earlier on, and they are still staying in ICU. You are correct. The 58 critical cases are were reported yesterday. Still, you have to understand that the condition may change every day. Some patients' condition will improve, some may deteriorate, and some, unfortunately, would pass away. So for newly reported critical or serious cases, we would require prompt reporting for these patients. We want our medical staff to spend more time to care for each patient. However, we also hope that a detailed medical record can be made, because it will help us analyze the data. The situation is still developing, and our frontline staff are very busy caring for the patients, so they may not be able to update the record promptly. So we will report to you all the most updated figure. Later on, we will perform analysis and announce the new, latest analysis. And also, you asked about vaccination. We do have guidelines in place for the frontline staff on what oral medications should be prescribed. Factors include the age, whether the patient is immunocompromised, whether the patient has low blood oxygen level, and whether there are pneumonia symptoms. Vaccinated or not is one of the considerations. So as doctors, when we make a decision, we have to make a risk assessment. The drugs come with side effects. If the patient is healthy, received 3 jabs with mild symptoms and young, then it's necessary to prescribe oral medication to them.
For a patient who is a bit older and who's weaker, would it be better for us to prescribe this medicine to him? I'm not saying whether we should or should not prescribe this sort of oral medication. Maybe, well, it's not going to be like a vending machine in which you click one button and the drugs will fall out. We need to make decisions based on guidelines, and to also to make a risk assessment before we come to any medical decision. My understanding is that there are currently 4 or 5 halls operated by the SWD. And one of them actually caters to patients discharged by the HA. And we regularly send out outreach teams to visit those patients. I have been in communication with the outreach team, and very often they are contacted by the AWE staff, and they can provide medical support at any times. So there are doctors and nurses around. You have to understand that it's an isolation facility for the elderly, and the suitable patients to be treated under this care are sent there. We provide support as best as we could. Next question.
Hong Kong International Business Channel. This morning, Dr. Kopat Singh said the mainland medical staff cooperate with Hong Kong medics smoothly, as they both share similar knowledge of international medical jargons. A specific computer system in Chinese has also been set up to cater for these mainland medics, so as to facilitate medical documentation. However, some Hong Kong medics say they feel like they have to become gatekeepers for mainland staff. How would the HA respond to that? Whether this will actually put more burden on the Hong Kong staff's workload? Are there any medical incidents resulting from the COVID oral medication so far as well? And then we'd also like to ask for a follow-up on Asia World Expo. There were issues with bathing and also manpower shortage. Has the situation improved, and has the mainland team has helped curb manpower shortage in the expo? Thank you.
The mainland healthcare workers who come to Hong Kong did help HA a lot, including they can share the medical knowledge, they can give the medical and nursing care to the patients in our hospital authority. In the past few days, what I know is they have a lot of exchange in terms of the knowledge, in terms of the treatment protocol, in terms of the drug use, anything related to the treatment and the management of the patients. They will try to make a more communication and try to arrive a good practice among themselves. Yes, for the documentation in the HA system, we use English. However, we all know that the expertise who come from China also know English. They can use they can read the English. They know what is the meaning of the medical jargon, because we are reading the international journals. We use the same language in the communications of the medicine. Yes, we try to make a interface for our mainland expertise to enter the record into our system, to facilitate them to use Chinese. But what they write in the record, our workers can read, because we all know Chinese, right? So there's no barrier between the mainland expertise and our local HA workers.
Next question, please. From cable TV. I'd like to ask about the passing away of the 49-year-old. Have you issued a home quarantine order to that person or anti-epidemic bags? I want to know which vaccine this person took. Was it Sinovac or was it BioNTech? For the designated clinics, is the utilization rate of the booking line very high? Would some who are actually eligible for the care booking line make booking for a regular patient? And vulnerable, and Professor Cole said that improvements should be made in the way in how they take care of the patient. So what do you think of that? Currently, I do not have any further information on the 49-year-old. I think the HA is looking into the details. I only have a number. I do not yet have the details. For the reinfection rate, it's about 510 cases, and we have asked our laboratory to conduct a genome sequencing to see which variant it is, and we believe that those who were reinfected were actually infected in the fourth wave for the first time.
Now about the 49-year-old deceased patient, according to the record, the patient has received 2 doses of Sinovac. Now some statistics. As at 1 p.m. today, the 23 designated clinics have offered consultation services for some 60,000 patients. The care booking hotline since the opening on the a few days ago, booking arrangements has been made for some 4,400 patients with high-risk factors. We will continue to monitor the demand of the service. Now, why we have the HA Go app for booking designated clinics? It is to facilitate booking for the public. I believe we all have the experience of using apps to make a booking for everything. It is much more convenient. So I appeal to the public, if you are not eligible for the care booking hotline, you should use the HA Go app. It would be faster. For the AWE services, there are 2 aspects. For the part under HA, we have doctors around the clock, plus the mainland experts. For the part run by the SWD, I don't have much information. Of course, we have sent colleagues, including colleagues under the HA, doctors and nurses, to offer medical assistance to those patients. Appropriate care as well as medication would be given to those patients. As you mentioned this morning, Dr. Tony Ko mentioned that we should improve our service. Of course, when room for improvement is identified, we will definitely make improvements so as to optimize our care and services so that patients' situation will not deteriorate or even pass away. What about Professor Yun's comments on resumption of flights? Well, I believe that the HASAL government will make reference to experts' opinions and consider all the relevant factors. Next question.
From SCMP. So first, is the first dose vaccination rate among the elderly slowing down? What is the possible reason behind this, and what will the government do? And second, how many mainland healthcare workers would be further needed apart from the 375 staff who have arrived in the city in the previous few days? And third, why is the fatality rate of the COVID-19 patients remain at a high level? What can the HA do to further lower the death numbers? And lastly, can we have an update on the condition of the 3 patients under 3 years old and in their 20s who are currently hospitalized in the ICU with the critical conditions? Thank you.
We of course will encourage all eligible, all people in Hong Kong to receive vaccination if they have not received any before, and also to complete their course, and even if necessary, they have to receive another dose.
Up to this moment, there are around 300 to 400 mainland expertise who come to Hong Kong to help us to treat the patient in the AWE. As what Chief Executive of Hong Kong said, there will be more and more healthcare workers who come to Hong Kong to help us. For the HA strategies in treating the patients, now we are trying to triage the patient and then putting the patient in the right place to receive the better treatment. We put the patients who need more critical care in the ICU, who need more medical care in our general hospital. At the same time, we want to triage the patient to the other facilities, including the Hong Kong Infection Control Centers under the North Lantau Hospital, and then the AWE. At this moment, we have more workers and more health care professionals here. They can provide better and also intensive treatment, including they can give the intravenous medication, intravenous fluid, oxygen, etc. And at the same time, we also know that some patients who have mild symptoms only, or even no symptoms, they will be put in the isolation facilities. In the isolation facilities, there are also medical support, including the hotline, including the on-site medical and nursing support, etc. And those patients who are waiting at home, they can still get a lot of support, including the hotline, the designated clinic, as well as what I introduced a few days ago about the internet, the message as well as the reminder for the rapid antigen test.
I would also like to supplement that from the local data so far we have collected, it is very obvious that those who have not received any vaccination or who have not received complete course vaccination, they have much worse outcome. Their mortality rate is much higher than those who have not received completed doses of vaccines. You can
go to our website and find out the vaccination rate. Next question, the lady in the front. Good afternoon, Hong Kong 01. Yesterday, the chief executive said at the press briefing, according to the HKU, the vaccination at the virus fertility rate has dropped below 1. So when can we have 4-digit or even 3-digit daily infection figures again? Now, so far, those patients who are taking oral medication has the medication suppressed the virus, and would the outcome be better after recovery? And about the 49-year-old deceased patient, is the patient a male or female, and which hospital was the patient admitted into? Now, according to some recovered patients, it is very hard to get the certificate. According to the guidelines to private doctors, the exemption does not include previous infection. Now, would you issue the clearer guidelines to private doctors? Well, I think you can refer to the University of Hong Kong's mathematic model. We haven't done a modeling on the estimation. About the guidelines related to private doctors, well, I will ask my team to see whether there are follow-ups. So far, I don't have the figures about the efficacy of the oral medication. So for the Merck medicine, that is, it was prescribed to some 6,000 patients. Generally speaking, patients recovered well, and very few patients experienced unwell. After taking the drug, so it is helping. Many patients have mild symptoms. They are of a young age or with no really have to take the drugs. However, for those who have taken it, it helped. So I can't simply tell you the efficacy of the two drugs right now. You won't believe me if I tell you they are very effective at this point. So the point is, you have to look at the international studies concerning the two medications. They are available. I believe that with more patients receiving prescription of the two medications, our experts will analyze the data and see how effective the two drugs are. And about the 49-year-old deceased patient, she was a female. She was admitted into the United Christian Hospital. Next question.
Hello from AM 730. Well, on the service of designated clinics, readers have reflected their views that a family member who is immobile would like to receive some sort of medication, but then as that patient needs to personally be diagnosed at the clinic, it is very difficult for him to get medication. So do you have any support for those who find it inconvenient to go out? And yesterday, we learned that some deaths would be reviewed to see whether they are related to COVID or not. So would you fine-tune the death number? In the first, fourth wave, we see that there are some fatalities after they have recovered. The hotline can only be reached during opening hours. However, the HA Go app will be available all the time, would you reserve some slots for phone in to ensure that there are enough bookings for those who do not use the app? And as you said, the utilization rate is not 100%. Why do you think is that? Maybe Dr. Lau can tell us more about the information on the deaths to see whether the deaths were caused by COVID or by other factors. And we can give you the details later. On the topic of designated clinics, you have to understand that our designated clinics are designed to help those who have tested preliminary positive, and these people only suffer from mild symptoms and would only like to receive medication. Well, we need to strike a balance. How many booking slots should we allocate to the care booking line? How many should we leave for the general public? This is something we need to consider every day because we only have around 4,000 slots a day. But that's all the resources we have. If half of them are allocated to the care booking line, and I open up the system for easier booking, then it might be harder for some other people to book. We place top priority for the elderly and for those who are immunocompromised and those under the age of 5. We want them to be treated as soon as possible and to take oral drugs if appropriate. We continue to improve our system. Well, we started off with only a few designated clinics. Now there are a total number of 23, and initially we started off with only a hotline, and then we added in the care booking line and now the HA Go system. We would of course try to provide support. You can raise this issue to doctors to see whether arrangements could be made. We treat patients, and of course, doctors can use their discretion. So it can be seen on a case-by-case basis. I hope that the members of the public could be more understanding. As Dr. Trong said, every day, different experts will review the deaths. The experts will discuss via Zoom on the individual cases to better understand the cause of death. A young person passed away due to COVID. But it was stated that it's caused by COVID. But then it should have nothing to do with COVID because that person fell from height. We want to identify the causes of death, so we need to study some of the medical records. Well, of course, this is not under my ambit. I do not have expertise in this area, but I only found out that this particular person died maybe not because due to COVID, but it's just a coincidence that that person was tested positive. We have really experienced and senior experts working on that. But give us some time because it takes quite some time to discuss and come to an understanding on all these cases. And we would adopt the views, much like how we adopted many of the views given by the Mainland experts in treating COVID. Last question, please. Hello from Oriental Daily. This morning, the chief executive talked about fine-tuning the details of the compulsory universal testing. Would the HA have any idea on when this universal testing will take place? When will be a more suitable time to do the testing to cut off all transmission chains? Many people have stated that they have allergies arising from vaccines, but as BioNTech community is quite new and they do not know what kind of allergies should not be included, and so they are not able to get medical proof for being exempted from the vaccine. So how could these people get medical exemptions? Many medical staff have arrived from the mainland. I'm sure many people are grateful to them and would like to express their gratitude. Would there be a channel for members of the public to express their gratitude to these medical staff? I do not have anything to say about the compulsory universal testing, but for clinical incidents, I do not have anything to say for now. I'm sure all of us are indeed very grateful to the mainland medical staff. Well, there are many ways you could do that. You can pray for them. You can stay vigilant, get vaccinated, wear your mask properly. I see many people on the street not wearing masks or have taken off their masks to smoke. We all need to do our part to be vigilant, to stay healthy, and that's already a good way of expressing your gratitude to the medical staff. And I'm sure that with our concerted efforts, we'll really be able to fight the pandemic. I'm sorry, I forgot the hotline just now, but the hotline number is 1-836-115. So for those who feel unwell at home, this is a medical support hotline. I know that there are some other support hotlines from the HAD for essential needs, but then this hotline 1-836-115 is solely for medical inquiries, and medical advice would be given.
Speaker not coming through the mic. I can't hear you, sorry. Whether there is resuscitation equipment at the AWE? Yes, we do. You mean the halls are run by HA? Yes. Like I said, one of the areas where the mainland medic teams would train with us is resuscitation procedures. There is a set of resuscitation procedures, and we had to make sure that the two teams could work together and perform the necessary procedures. I don't have information on that. This is the end of the media briefing. Thank you very much.